The stainless steel crown is an exceptionally important element of restorative dentistry for children. For young children with a high dental caries risk and who have already manifested caries lesions affecting the proximal surfaces of their primary molars, the stainless steel crown is the material of choice. Large intracoronal restorations in primary molars have proven not to be successful in allowing primary molars to remain disease-free and to preserve space in the arch for the developing teeth. Amalgam and composite restorations, when larger than ideal size and in children with moderate to severe caries risk, often break down and cause infection, space loss, and additional problems. Stainless steel crowns are often placed while young children are treated under general anesthesia. Because the child is asleep and treatment can be performed in an ideal setting with good isolation, many stainless steel crowns can be placed simultaneously. This video will demonstrate how the stainless steel crown is placed while a child is treated in the operating room under general anesthesia. We will show both a single crown placement and placement of two crowns in adjacent primary molars. The individual crown preparation and placement techniques in these two scenarios are similar, but there are some special considerations when placing two crowns on adjacent primary molars, particularly in the common situation where space has been lost due to interproximal caries. After obtaining radiographs, one can see interproximal lesions present in the primary molars of the patient. After prophylaxis, the quadrant, segment, or entire mouth is isolated with a rubber dam. If only stainless steel crowns are to be placed within the segments isolated, it is acceptable to cut the dam interproximally between the primary molars to avoid tearing during tooth preparation. The stainless steel crown molar preparation is carried out on several successive steps. First, a large diamond or carbide burr is used to obtain occlusal reduction on both buccal and lingual cusp slopes. This reduction must be at least 1 millimeter in depth and preferably 1.25 millimeters, and in some situations, depending on the occlusion of the child, up to 1.5 millimeters in depth. Next, interproximal separation is obtained. For this, either a diamond or carbide burr is used to reduce the enamel interproximally and to obtain clear opening between the teeth to allow for the full contoured thickness of the molar stainless steel crown. Even when there is a natural separation between one of the surfaces and the adjacent tooth, there needs to be preparation of 1 millimeter of proximal thickness to allow for the contoured and anatomically correct shape of the stainless steel crown. The thickness of the proximal separation is of particular importance when two adjacent molar stainless steel crowns are placed. Care must be taken to avoid creation of a ledge interproximally during preparation. One must also protect adjacent teeth that will not be prepared and be cautious of the gingiva. Finally, a long bevel is placed from the occlusal surface from each of the prepared cuspal slopes into the buccal and lingual surfaces. This bevel will allow a smooth angular transition between the occlusal reduction and the buccal and lingual surfaces, and will allow the stainless steel crown to slide into a fit when placed. It is essential that there is not a direct preparation of either the buccal or lingual surfaces. These surfaces have morphological features which include a prominent bulge on their gingival aspect. This gingival bulge must remain intact to allow the stainless steel crown to snap over the buccal and lingual surfaces. After preparation, the right size of stainless steel crown must be selected. We have chosen the Hu-Friedy Pedo Crowns. These stainless steel crowns are pre-crimped and pre-contoured and have the natural and anatomically correct shapes. They are trimmed to the typical height requirement of primary molars, but can be cut to reduce sulcular extension if needed. In some cases, there has already been space loss interproximally. In this instance, the Hu-Friedy Pedo Crowns can be gently squeezed using Howe pliers on their mesial and distal aspects simultaneously, thereby reducing the mesial-distal dimension while slightly increasing the buccal lingual dimension. This will allow the shape of the stainless steel crown to fit the space allowable when there is space loss. The size of crown is in the range of size 2 through size 7. The vast majority of stainless steel crowns used is of sizes 4, 5, and 6. The best guess for the right size to try on is based upon the mesial-distal dimension. After selecting a crown to try on, the crown is placed onto the lingual surface and snapped over the buccal surface, or vice versa. If there is a fit, one will see the correct marginal ridge height compared to adjacent marginal ridges. Then write sulcular depth as determined with an explorer and carefully contoured proximal margins. If there is a good fit but the margins are open, the crown can be further trimmed and/or crimped to obtain the perfect fit. If an adjacent stainless steel crown is to be placed, the same procedure should be performed, and both crowns must be fitted simultaneously. Once all of the crowns to be placed are properly fitted, they can be cemented. Crowns can be cemented with the rubber dam in place if possible. Because the rubber dam clamp on the second primary molars often interferes with the placement and cementation of the stainless steel crown, it may be necessary to remove the rubber dam prior to cementing the second primary molar stainless steel crowns. Glass ionomer cement is most commonly used to place stainless steel crowns. It chemically adheres to the tooth structure and bonds well to stainless steel crowns. After mixing, the crowns are filled to the extent of about half full, and the crowns are placed quadrant by quadrant as needed. Careful cleanup must be done facially, lingually, and interproximally without disturbing the crown's placement. Generally, it is difficult to assess occlusion under general anesthesia. That is why assessment of placed marginal ridge height is essential. If a pulpotomy is necessary, a stainless steel crown is placed over the sealed pulp chamber and placed in the same manner. Stainless steel crowns, when easily and properly placed, will allow primary molars to remain healthy in the mouth of the child until their natural exfoliation, and will retain the space needed for the developing permanent teeth.
Hi, my name is Mariela Garcia. I have been a pediatric dentist for the past 4 years. Stainless steel crowns are the best option for restorative treatment when there's advanced deterioration due to caries in a child's tooth, providing them to restore the normal anatomy of the tooth. One of the most common questions that we get from parents is, why are we placing stainless steel crowns? My first answer is the amount of dental caries that a tooth is presenting, the extension of the lesion, and also the amount of restorative material will need to be used to restore this tooth. Given those conditions, what we usually suggest is a full coverage restoration that has a most predictable and definitive solution. Stainless steel crowns provide that full coverage and resistance that can definitely last until the life of the tooth and natural exfoliation of this tooth. Another question that parents usually have is, why should we keep a tooth that has such advanced dental disease in the mouth of their children? And the answer that we usually give them is that, for sure, removing a tooth before the normal time of exfoliation can end up in space loss that can affect the position of the new teeth to come. In cases where there are multiple restorative needs and we can identify the possible causes of the establishment of dental caries, we try to complement the restorative treatment with a preventive plan, usually involving changes in habits of oral hygiene and diet at home that can prevent the dental disease to come back and affect the same teeth or others that have been restored. One of the major challenges in treating a child on the chair is the behavior management. That can for sure impact the outcome of the procedure. And it's not only that you're going to be focusing on the dentistry, but you need to focus in all of the overall well-being of the child during that procedure. There's constant distraction that you need to apply. You need to make sure all of the tissues are being well protected, and you need to know that the appointment is going not only well for you but for the child. So your mind has to be divided into the well-being of the child and achieving this procedure the best quality and in a faster manner, so we don't prolong this time that the child for sure is making an effort to help and get it achieved. And it's a big challenge, and we know compared to adults that many adults have big challenges to overcome when they're relating to dentistry. So that's what makes these moments in the dental chair so precious, because you can build up that confidence into letting someone go into your mouth and provide care when it's very difficult to even adults to do it. So that building up that trust and that relationship with the patient is what creates an environment that can make you perform at your best and do an excellent job, not only clinically, but also for the child that is learning how to adapt to this environment. A major advantage of the Hu-Friedy Pedo Crowns is the smaller mesial-distal width, which reduces the amount of fitting needed to place the crown.